it gives me much pleasure when we meet time and again to discuss the things we all love the most. We are here as sonographers for life. We are here as radiologists for life. So to us, perfection is part of our lifestyle. We can't be professionals without professionalism. So in this module, I am going to discuss on one of the key aspects that most of you miss, that most of you don't understand. So over the time, there's been changes, or there are some new things which are being discovered in the world of sonography, just like any other world. So with experience, it's now possible for one to determine the fetal gender or the fetal sex in the first trimester. When you do your nasal translucent ultrasound scan in the first trimester, from 11 to 13 plus 6 days, it's possible that you can also detect the fetal gender. So that's the subject of our module today. So just relax. I am going to take you through how you do it. And when you do it so accurately, it gives satisfaction from your patients, satisfaction from your colleagues, and also it boosts your professional integrity. So, what are the areas that I'm going to touch on? This is a very short module. I am going to touch on the introductory part, which is what I have started already. The importance of fetal gender determination. Why is it so important? I am going to touch on this aspect. Then I'm going to move on the methods of ultrasound for fetal sex determination. Then there are also factors which can hinder the process, and you might fail also to get the correct gender. So I'm going to also discuss on the factors which influence the accuracy of the ultrasound scan. Then I will move on to discuss and identify fetal gender from experience. Like when you visualize a lot of images, you can be able to pick sex in the first trimester. I'm going to also explain the technique of how you do it. So I am also going to recommend you to do a lot of case studies, be it from your department or with fellow colleagues. You can be sharing the cases, or in groups, WhatsApp groups, you share the images and you try to predict the sex. This can eager your experience and it can nourish your expertise when it comes to gender determination in the first trimester. So I'm also going to give in a brief summary after the module, and then the quiz I need you to do on your own. So organize yourself into groups, then quiz yourselves, share images as many as you can. This is going to help you to perfect your skill. So why is it so important for fetal gender determination, especially at an early age? It can provide a valuable information for families and healthcare providers. You know, some by tradition they say that we need a boy child. Some they say we need a girl child. So it can give closure to certain issues, and also it can reconnect people if their preferred gender, for instance, is the one that you're going to tell them. Again, on the contrary, it can create, or it can widen the differences or the animosity between a couple when they realize that the gender is not what they expected. So it is very prudent from this background that you must do the correct thing. You must tell the patient the correct gender at any given time. So when you are not sure, you have to be realistic and notify or tell the patient that you can't in that particular stage in time. It's not a crime. Unlike to tell the patient a wrong sex then or gender, then when the baby is born, they come back to you. So early knowledge of fetal sex allows families to prepare emotionally, make informed decisions, and bond with the baby. So I've already alluded to this. So families can bond more when a correct gender is diagnosed at an early stage in life. So what are some of the methods that we use in terms of gender determination? There are various ways that can be used, but we in our constituency, in our area, basically you can use the transabdominal ultrasound method, which involves the transducer that you place on the abdomen of the mother. Then you do the sonar like usual, or else you can do a transvaginal ultrasound scan, which is more accurate, mostly in the first trimester, when the fetus is still very small. So this is the ideal method that you can use, but for some, especially thin patients, you can also use your transabdominal sonar with success. So there are certain factors that can influence the accuracy of the ultrasound scan that you are going to do. So ultrasound scan is without its own challenges, just like any other procedure. So the accuracy of fetal sex determination using ultrasound increases advancing gestational age. So when the baby grows bigger, it means the structures can also be clearly seen, and then gender determination can also become much accurate and better. That's why provisionally we normally do the gender scan when we do our anatomy scan from 18 or 20 weeks going onwards, because at that time the genitalia will be clear and well formed. Fetal positioning and movement can sometimes affect the visibility and accuracy of ultrasound sex determination. So these are some of the things that you have to explain to your patient. You cannot just do the sonar without notifying the patient the hurdles or the challenges that you might face during the process. So the couple must know that it's not the machine itself which predicts the gender, it's you using your skill and the position of the patient, of the fetus, that allows you to make a prediction of the fetal gender. So if they know that you are also fallible, you can make a mistake, and you can mistake one structure for the other, so you give a percentage error. Like in the first trimester, with my patients, I give them about 80% error that the sonar might not be correct, but it might be correct up to 80%, 20% chances. So you have to come again for a confirmation of the gender in the second trimester going forward. So the technique that I want to introduce you to, the technique that is used in the first trimester, because the genitalia is not all that clear at this stage, they use what is called the genital tubercle. So the genital tubercle method is the one that I'm going to introduce you to. So what is a genital tubercle? A genital tubercle is also called a phallic tubercle. is a body of tissue present in the development of the reproductive system. It forms in the ventral caudal region of the mammalian embryos of both sexes and eventually develops into a primordial phallus. So in the human fetus, the genital tubercle develops around 4 weeks of gestation, and by week 9 becomes recognized either as a clitoris or as a penis. So you can see that from 4 weeks, the genital tubercle, it starts to develop. So that's why we say you can use the genital tubercle in the first trimester from 11 weeks if the fetus is in a good position for you to visualize. It's not always automatic that you're going to see the genital tubercle. You might not see it. And also it must be transparent to the patient to say that the fetal lie, for me today, it's difficult for me to do the genital tubercle method, so that they know. So let me capture a little bit of some embryology. What we have here is a diagram that is showing the male-female homologies. So this you are seeing here is a genital tubercle. Then we have got below it a urogenital sinus, and then we have got the urogenital fold. Then you have got the labio-scrotal swelling, which is here. So you can see that in early development, it's very difficult for you to distinguish between the labia and the scrotum at this stage. But this is how the embryology, how it is coming from. But I don't need you to load you with unnecessary information that can divert the subject that we have, which is relevant to the field of sonography. So a little more dose of embryology here. So from week 1 to 6, embryo is sexually indifferent. Like, it's very difficult for you, it's indistinguishable to say that this is a boy or is a girl. So the anatomical features at this stage, or the embryological features at this age, they are almost the same. So genetically, male and female embryos are phenotypically the same. Both male and female have mesonephric, which is called the Warfarin ducts, at this stage. So you cannot try to do miracles to say that from 1 to 6 weeks you can visualize the fetal sex on sonar. No, you can't. So when we get to the 7th week now, sexual differentiation then occurs. So at this stage, up to week 12, sex of embryo can be distinct based on external genitalia. So now, distinction of the fetal gender can be made around 12 weeks from 7 weeks. That's why at this stage in the first trimester, that's why we do the genital tubercle method. So from week 20, phenotypical differentiation is now complete. So that's why you can see now the hamburger sign, you can see the turtle sign. At this stage, you can easily tell that this is a boy, this is a girl, because phenotypical differentiation at this stage will be complete. So now, how do you do what is called the genital tubercle method? This is how. So the first thing that you must do is your fetus must lie in the mid-sagittal view, or in the mid-sagittal profile, and then in neutral position. Then you capture your image like this. That's the same plane where you measure your crown rump length. So if you do it like this, you can see here, that's where the umbilical cord inserts. And then you must then draw a line that is following the spine here. This is a line that is following the spine. And then what you see here, this is what is called the genital tubercle. That bud of tissue that we have here, that's the genital tubercle. So if this line that follows the spine, and this that goes the genital tubercle like that, meet at around above, from 30 degrees and above, then that would be a male gender. But if you draw, you see this genital tubercle here, if you this line is to pass inside the genital tubercle straight like that, if you draw this line, and then you draw the other line following the spine here, if you see that these lines, they are parallel or less than 30 degrees like this, it means it's a female gender. So basically, this is how you do the genital tubercle method in the first trimester of pregnancy. But you must not celebrate and say that I've seen an angle that is above 30 degrees, so automatically it's a boy. You have to tell the patient that yes, presumably it's a boy, but you can also make a confirmatory sonar at 20 weeks and beyond, so that you can confirm the gender with certainty. But provisionally, that's how you determine the sex in the first trimester. Parallel lines, female gender. When the lines meet at 30 degrees and above, that's a male gender. So this is the genital tubercle method. So again, with the male fetus, the genital tubercle usually creates an angle of greater than 30 degrees within the lower part of the spine. So this is exactly what I was explaining in the previous slide. So that's a male gender. So this tissue or muscle that we have here are closer to the fetal bladder there. That's the genital tubercle. Do not mistake a fetal limb for a genital tubercle again. So this is some of the pitfalls that you can come across, and you can give false information to the patient. So again, when the lines are parallel like this, the genital tubercle protrudes in the same direction as the longer portion of the spine, with an angle of less than 30 degrees relative to the backbone. So if this angle is less than 30 degrees or is almost parallel like that, you can make a diagnosis of a female gender. So here is a brief capture or summary again of this genital tubercle method. At this point in pregnancy, the genitals aren't developed enough to look much different. Whether it's a boy or it's a girl, it all looks like a little nub between the fetus legs. However, what's indicative of the baby gender is the angle that nub is pointing at. If the angle is greater than 30 degrees or more to the baby spine, not the uterine wall, then it's indicative of a boy. If it's parallel to the or less than 30 degrees, then it's a girl. So that is exactly what I was explaining. So do not make the line parallel to the uterine wall, but it has to draw the line along the spine, the back of the fetal spine, and then you draw another line on the genital tubercle and see how it all goes. So what are the variables? What are the variables when you are doing this type of a sonar? So the predictor or independent variables include embryos, crown rump length. So the crown rump length also it comes into play when you are doing the genital tubercle method, because you must know that when it's too small, it might also give you false results. So the fetal position, this is very critical. The fetal position, fetal lie, if you don't get a neutral position, you might also have a challenge in terms of getting a correct diagnosis or prediction of the gender of the fetus. So, and also, what is key, or what is above all, is the experience of you as a sonographer. Are you experienced enough? Because the technique needs you to be able to know what you're doing, to draw the lines and see how they're meeting, or if they're parallel lines. At the same time, for you to be able to capture the neutral position of the fetus. So what are some of the challenges of this genital tubercle method? The problem becomes when the angle isn't clear. That's the first thing. When the angle isn't clear, it's very difficult for you now to say which is which. All babies develop at their own speeds, and one baby might point parallel at 13 weeks, but then rise up over 30% to become a boy. So you can see that the diagnosis or the prediction of a boy can be a challenge. Like the genital tubercle, it will look more like parallel, then with time it rises up, and then it makes an angle that is above 30 degrees with time. So you can provisionally, or when you do it earlier, you might think that it's a girl. And another baby can have an obvious boy nub at 12 weeks. However, obviously, boyish nubs almost never turn out to be girls. So basically, if you are correct with your technique and you see that the angle is above 30 degrees, provisionally, that is 100% a boy. But the thing that is confusing is when the angle is below 30 degrees. That's where it's very difficult to say which is which. So the female genitalia or the female gender is more difficult to predict because it can overlap also with the male genitalia, which becomes a challenge. So these are some of the challenges again, which can impede the prediction of fetal genitalia in the first trimester: maternal obesity, site of previous abdominal surgeries, weeks of pregnancy, the fetal abnormality, uterine positioning, fetal positioning, quality of the medical ultrasound device that is also used. So you can see that obese mothers can pose a challenge because with obesity, you can have a placentamegaly, the growth of the fetus can also be increased. So all those challenges can also hinder you from visualizing the genital tubercle very well. So the site of the previous abdominal surgeries can also influence because the scar tissue there can also calcify. There can be granulomas or there can be calcifications there, which can also hinder or be on the way. So if also you've got some uterine lesions or masses like fibroids, they can also disturb the visualization of the genital tubercle, and you can also have a challenge in terms of capturing the correct angle. So the weeks of pregnancy, the earlier it is, you if I highlighted before, it's very difficult for you because the genital tubercles will still be developing, and later the genital tubercle tends to resolve as well. Then it becomes a challenge. Then you have to wait until you use the actual genitalia to make the prediction. So the position of the fetus also is a challenge because the fetus can move, can assume variable positions. Also, the number of the fetuses. So multiple pregnancies also can pose its own challenges because it will be very difficult for you to get the profile position of both or multiple pregnancy fetuses. So the position of the uterus also can have a bearing. You can have a retrofitted uterus, retroflexed uterus. So all those can be problems as well that you can encounter when you want to align the baby for a genital tubercle prediction. So the quality of the equipment. So this one is also very critical. Do not underestimate the quality of the machine that you're using. So low resolution or old machines can also give you problems. So it's not about the quality of the machine, also can also have to do with the expertise of you, the operator. At times you might have a high-end machine, but you don't know how to adjust the knobology to get the best image again. That can pose a challenge. So this is more like it. For you to get the necessary exposure, I need you to carry out certain activities that can help you to be proficient or to gain the experience that you need to do the genital tubercle method. So these are some of the activities which I need you to do. I want you to learn as much as you can to identify male and fetal genitalia characteristics on ultrasound images for accurate determination. So in your groups, wherever you work with your colleagues, try as much as you can. Each time that you find a pregnant woman that comes to the department in the first trimester, try to make a prediction, share the images with the colleagues as well, so that you can learn how to use the genital tubercle method to predict fetal gender. So engage in interactive activities to practice identifying the fetal genitalia using ultrasound images. So this is more like the same. So you have to also have case studies that you can do and make a follow-up on. Like if you find that there's a pregnant woman that comes in the 12th week, in the first trimester, and then you book again them for the detailed sonar, you must also do a follow-up to see if what you predicted is coming out to be true with the actual genitalia. So this is self-assessment, self-evaluation is also very critical. Okay. So in summary, I need all of us to be involved. You know, the problem of some of us or some of you learn things, you learn the theory part, but you don't put the theoretical aspect into practice. If you see an image that was taken by someone, just demonstrate the crown rumble length. For you, it sounds like something that is very easy. At the same time, when you see someone doing the genital tubercle technique, you think that is very easy. But in real terms, it's not very easy. There are so many challenges, including the body build of the patient. Also, the baby moves. So it can be a challenge again for you because of all those problems. Oligohydramnios, all those other challenges. Multiple pregnancy, fibroids, they are all challenges that you can come across when you're trying to do the genital tubercle method. So it takes experience for you to be masters of anything. So as much as you can, I need you to take your time. Take your time for self-test. It's no longer high school or university time where people are going to give you assignments, but you are the own maker of your own destiny. The expertise and the experience that you need is all in your hands. So to those who are willing to learn, this is the Bible. These are the verses. We take it every step along the way. But you are going to see that if you acquire these skills in your life, you are going to be an efficient practitioner. At the same time, you're going to connect with your clients because you are doing the impossibles. Imagine a couple has 2 kids and previously they had sonars and they were told that it's not possible for us to predict the gender in the first trimester, and you discover that you are the first to do that, and you know they would treat you with all the dignity and everything. You understand? So let's try our best to foster a culture of learning so that we become the best versions of ourselves. So if you stand on the shoulders of giants, it means at one point in your life, you are also going to be a giant. I thank you so much. Thank you for your time. Let's meet again in the coming modules. Enjoy your day. Enjoy your days ahead. Thank you.